Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about something really serious actually, which is, are you an individual who feels like you're on overload? Visual overload, sensory overload. Are you struggling with your vision and maybe you're light sensitive, sound sensitive? There's too much going on. You just can't take it. Maybe you've got vertigo or even some tinnitus, ringing in the ears. So vertigo would be like dizziness or feeling like things are moving around or feeling like you're moving around, which is a condition if you're seeing it, feeling it, and seeing it like looking like it's moving and you feel like you're moving, it's oscillopsia. There can be lots of things going on, and I want to talk to you about this sensory overload neurologically that can happen for some people. Now, before I do that, let's talk about how you can connect with us. Our phone number is 618-288-1489 if you're local. If you're not local, you can still connect with us and talk to us about how we might be able to help you. Go to our website at visionforlifeworks.com and you can do one of two things: fill out a questionnaire and get feedback about your vision, or you can schedule a consultation to talk with me directly. Now, are you that adult, or maybe it's your child who's on visual overload and sensory overload? It could have happened all of a sudden. It may have been sparked by an accident, so like a traumatic brain injury, a stroke, a concussion, whiplash injury. Could be even something toxic that you were introduced to, or even a medication type of reaction neurologically. So there can be lots of things that can cause a neurological overload. But if that's you, then you are listening and probably tuning up and paying really close attention to this video. You're definitely going to know what your symptoms are. You can probably list them off really fast for me. And this video is absolutely for you. Now, some patients, we would say like, ooh, Syntonics right away, that's going to calm you down. Let's get you on a couple of appropriate filters to help calm down your neurological system, and then we can get to work as to what's really going on with your vision problems or what's really happening with you. Now, many times, and I would say most of the time, 99.999999999 and a zillion nines% of the time, Syntonics is exactly the thing that you need to work on first. And I want to show you a couple of filters that we utilize specifically for this purpose. Now, most of the time, about 99.9% of the time, I chopped off all the nines, there's a filter that we utilize that's kind of like this purpley blue. And that filter is a brain healing filter. And it's typically the one that we're going to use most of the time. But if a person is on serious neurological overload, that might not be the appropriate filter for them to go on. And let's show you a couple of others that could be more appropriate. This one is more of a balancing type of filter. And you can see it's actually kind of red, but it's going to do some balancing of the neurological system. Other times, we might feel like we've got to do something a little bit different, completely different. In fact, this one, which you can see easily, really without even the flashlight, if I hold it up there right, it's this really brilliant purple color. Sometimes these filters are needed out of the norm, out of the typical sequence of maybe everything else that we've learned and everything else that we've done for our patients. And so I have a system with Syntonics. In fact, I kind of created my own Syntonics system, and it's designed to take people through healing of their brain, balancing their neurological system, balancing out the two hemispheres of their brain, balancing out certain things with the alignment of their eyes, and then a few things beyond that. And I've created this system. It's been really amazing for most all of our patients, but every now and then I get one of those people who's just so neurologically overstimulated, whether they've had some sort of traumatic brain injury, as I've mentioned, like whiplash or concussion, or car wreck, which probably resulted in whiplash or concussion. Or maybe it's, again, something else like a toxic reaction or a medication-induced type of reaction that we're trying to get them to neurologically just settle down. Some of these other filters may be appropriate. That really purpley purple one that I showed you is actually great for people who feel like they've gotten a little bit neurotic, or they feel like they've gotten a little bit more OCD-like than they were before. And if they feel like they're just kind of like all over the board, they just can't control their emotions, then that one that was kind of in between, this one right here, that's a little bit more, it's kind of a combination, it's more red. That might actually be the better one to start off with initially. Now, the other thing that's really important about Syntonics is that it's really important that the amount of time be paid attention to. And so for those of you who have either, maybe you're in Syntonics right now or you're thinking about it, there's a couple of things that you want to know. There are some many suggestions of the amount of time that we use for Syntonics being 10 minutes for every filter. And what I found over the years, and I've been using Syntonics for about the last 12, 13, I don't know, I lose track, couple of years, is that most of my patients actually don't do very well with too large of a time frame that they're using their Syntonic filters for. So those things where it's kind of like, you know, use this filter for 10 minutes and use this filter for 10 minutes and use this one for 10 minutes can be way too much stimulation neurologically for the individual who's gone through a neurological incident. In fact, some of our patients might require something like only 30 seconds worth of time on a particular filter to gain the benefit out of it, but not overstimulate the brain. What I tell people is that there are several ways that we can work on helping our neurological system. We can actually go at it really nice and slow, like let's tiptoe through the tulips, okay, slow, all right? I don't know where that came from, but I'm sure you enjoyed it, and that's probably going to be a great part of the video. Anyway, okay, so we can kind of tiptoe through helping someone with their vision. Or we can go a little bit more direct and go more specific and be a little bit more pointed with the time and the things that we're doing. Or we can do what I call a step on the brain, all right? And so in these particular instances, stepping on the brain is just like, let's just do it all. Let's just try to get everything in there that we can do. Whew, too much. So those patients who are overstimulated to begin with can now become super extra overstimulated. Have I had those happen myself? Yes, you bet. That's actually exactly why I can sit here and talk about it today. I have had those cases. In fact, every now and then I still have those cases where the person gets way overstimulated and we have to back off and figure out like, whoa, what are we going to do here with this individual? They are just too neurologically upset right now. So I'm making this video primarily to bring awareness to, most of the time, Syntonics is exactly what you need. 99.9999999999999 a zillion 9% of the time. It's going to be exactly what you need to help calm your neurological system and then help us get to the root of the problem and correct it and fix it. But in rare instances, there is that one in a bazillion, it feels like, person that it might not be the right thing for them to do, or they may have to start at it at a much slower pace than what is ever, you know, thought to be kind of like the normal program of what we do. And it's those situations that we have to be really, really careful about. So if you've gone through it and you've experienced that, I think my brain was stepped on and I'm like neurologically overstimulated, I get that, because again, I've done that before in the past when I was first learning. And I've even got, you know, a case right now of an individual who got way overstimulated with his Syntonics program, and we had to say, whoa, let's back way off. These things can still happen. We still have cases out there of patients who've been traumatically brain injured, and maybe they've had multiple brain injuries, and they're coming in and they're highly sensitive patients. And so, you know, you're not alone if that's happened to you. And if you want more information about how we work with individuals who have this really overloaded neurological system, then contact us. You can call us at 618-288-1489. You can go to our website if you're not local at visionforlifeworks.com, and you can fill out either a questionnaire or schedule a consultation directly with me and talk to me about what you've gone through. Now, if you like this video, hit the like button. If you have not done so already, please subscribe to our channel. And if you feel this could be beneficial, please pass it on. Thank you.